Hi, my name is Manuel Oja. My topic is a randomized trial of Hyperimmune Globulin to prevent congenital cytomegalovirus. Definition: congenital infection with human cytomegalovirus (CMV) is a major cause of morbidity and mortality. In an uncontrolled study published in 2005, administration of CMV-specific Hyperimmunoglobulin to pregnant women reduced with primary CMV infection significantly reduced the rate of intrauterine transmission from 40% to 16%.
Hyperimmune globulin is similar to intravenous immunoglobulin (IFIG), except that it is prepared from the plasma of donors with high titers of antibody against a specific organism or antigen. Some agents against which hyperimmune globulins are available include hepatitis B, rabies, tetanus toxin, varicella zoster, etc. Administration of hyperimmune globulin provides passive immunity to the patient against an agent. This is in contrast to vaccines that provide active immunity. However, vaccines take much longer to achieve that purpose, while hyperimmune globulin provides instant passive, short-lived immunity. Hyperimmune globulin may have serious side effects, thus usage is taken very seriously. Treatment with hyperimmune globulin in mothers with primary cytomegalovirus (CMV) infection has not been found to significantly decrease the risk of congenital cytomegalovirus infection. Hyperimmune serum is blood plasma containing high amounts of an antibody. It has been hypothesized that hyperimmune serum may be an effective therapy for persons infected with the Ebola virus.
Application in medicine. We evaluated the efficacy of Hyperimmune globulin in a phase 2 randomized, placebo-controlled, double-blind study. A total of 124 pregnant women with primary CMV infection at 5 to 26 weeks of gestation were randomized within 6 weeks after the presumed onset of infection to receive immunoglobulin or placebo every 4 weeks until 36 weeks of gestation or until detection of CMV in amniotic fluid.
The reason we thought that CMV hyperimmune globulin might prevent congenital infection of CMV are a couple. First, there's a long history of hyperimmune globulins potentially stopping infections during pregnancy. The second is there were prior data done in Europe that suggested that there might be some benefit of administration of hyperimmune globulin to prevent congenital CMV. Yes, the trial was stopped early at enrollment of 399 patients because the Data Safety Monitoring Board felt that the likelihood of showing benefit was so low that there was not any potential benefit of continuing the trial at that point. What we found, unfortunately, is that CMV hyperimmune globulin did not decrease the rates of congenital infection or fetal death among women with primary CMV infection during pregnancy. We also found that it did not decrease the risk of symptomatic congenital infection among those that were infected. And and there was an increase in some of the side effects that we were looking for among women who actually received hyperimmune globulin. So unfortunately, we found that it did not benefit women or their fetuses or infants, and potentially had increased side effects.
Pros and cons. This study was not shown to demonstrate a reduction in the transmission of congenital CMV infection among women who received hyperimmune EAG or placebo. Neither did it show an effect on the activity of the neutralizing HC. Those that are produced and have an early peak after the primary infection.
Imagine a virus that causes effects in pregnancy that are 30 times more common than toxoplasmosis, 30 times more common than listeria, and is proven to cause childhood deafness and cerebral palsy. Wouldn't you want to know how to reduce your risk of infection in pregnancy? Cytomegalovirus, or CMV, is the most common virus passed from mothers to babies during pregnancy, and it largely goes undetected as most healthy people will experience no symptoms. Every year in Australia, around 1,800 children will be born with CMV. Most of these babies will not be affected by the virus. However, more than 400 babies each year will experience long-term effects, including hearing loss, learning difficulties, epilepsy, and cerebral palsy. CMV is passed from person to person through contact with bodily fluids like urine and saliva. Toddlers can easily pick up the virus from each other and generally have no obvious symptoms. Pregnant mothers and their partners can become infected from children's urine and saliva. Your risk of passing the virus on to your developing baby is greatest the first time you are infected with CMV. Women who have young children or work with them are at increased risk of infection. The good news is you can reduce your risk of CMV infection in pregnancy because washing your hands for at least 15 seconds after activities like changing nappies is one of the 5 effective ways of preventing transmission. The other ways to help reduce your risk of CMV infection in pregnancy are not sharing food, drinks, utensils, and avoid putting a child's dummy or toothbrush in your mouth. Avoid contact with saliva when kissing a child. Try a kiss on the head rather than on the lips. Carefully throwing away nappies, used wipes and tissues. Cleaning toys that children have had contact with. These CMV prevention strategies will also help guard against many other common viruses. When it comes to reducing the risk of CMV infection, search CMV Prevention in Pregnancy for more.
Here we go. 1, 2, 3.
You would never know nearly 2-year-old Kobe Vey was born with a dangerous virus.
I only saw her for about 10 seconds, and they rushed her in to the intensive care nursery.
Kobe had been infected with Cytomegalovirus, or CMV for short.
It's terrifying. Absolutely terrifying.
CMV is transmitted by close contact with bodily secretions.
Most people are asymptomatic, so mom may not even know she has the virus, posing a serious risk to her unborn baby.
It can cause the same syndrome as Zika virus, the microcephaly, severe brain damage, hearing loss. In fact, it's been estimated to be the cause of 25% of childhood hearing loss.
Pregnant women can pick up the virus simply by changing a diaper.
So toddlers like to share their saliva, and we change their diapers, and they, when infected, can shed the virus very easily in those fluids.
Researchers at Duke University wanted to know how they could better protect moms and their babies from CMV. Dr. Sally Permar and her team have successfully tested a CMV vaccine in animals. There's currently a simple way to test infants using a cotton swab to gather saliva.
Where's the doggy?
Covey was tested and diagnosed at birth. She was given antivirals right away. Her mom believes that's what saved her child.
Now she's running around, she's climbing on anything and everything.
With hope that one day all babies will be tested for CMV. I'm Marty Salt reporting.
Issue applying in Ecuador. In Ecuador, there was intravenous transmission in 37% of the cases. Congenital infection was diagnosed antenatality in 40%, uninfected fetus and postnatality in 60% of fetus. 80% of the fetus with a negative viral load at amniocentesis had a positive viral load at birth. Of the group that received Hyperimmune AG, 30% had congenital infection of 44% of the placebo group. There were no significant difference in the viral load in the amniotic fluid of the infected fetus and the viral load in the blood or urine of the infected newborns. Conclusion: Hyperimmune AG did not significantly modify the maternal viral load in the blood of the time it takes for it to disappear, nor the viral load in the placentas. There were no significant differences in blood viral load between women who transmitted the virus and those who did not. The findings are not able to support that Hyperimmune AG will reduce the placental maternal viral load by a direct neutralizing effect, as had been proposed by previous studies. Administration of Hyperimmune AG also does not appear to have an effect on the viral specific T response. Thank you very much.